Welcome to Health in Retirement. Each week, we'll discuss some of the health challenges facing retirees. We'll focus on more than just physical health. We'll look at financial health, mental and emotional health, as well as spiritual health. With your host, Rebecca Jones. This is Health in Retirement.
Hi, I'm Rebecca Jones with Health in Retirement, where we talk about everything that has to do with your health when you are entering or are in retirement, whether that is your physical, mental, spiritual well-being, and yes, even financial. So today we have with us Dr. Anthony Shaw of psychiatry. Welcome, Dr. Anthony.
Hey, Rebecca. Thanks for having me.
Yeah, absolutely. So I would like to talk to you today about the different, aspects of mental health. I think sometimes maybe, even 25, 30 years ago, getting mental health there was still maybe a little taboo or stigma around seeking mental health. So in your experience when entering retirement, what are some things that you think these retirees need to be aware of?
Yeah. So that's a good question. So a lot of times the biggest transition to me when people are going into retirement is, most people, we're working 40 hours a week at least. So you have something you're doing. And a lot of times when you're going to these jobs, you're being social, you're interacting with people, you have people around you. And so when you're going to retirement, you want to think about, okay, I had this 8-hour block. This is what I'm doing all this day. I have something I'm waking up, something I'm doing. Mm-hmm. You're getting up.
Purpose.
Yeah, you have purpose. You have something to do. Now, once you're going in retirement, okay, now you have a big block of free time. You're no longer doing something, and you no longer have something that forces you to get up out of bed. You no longer have something that you interact with
whether you want
about.
To or not, right?
Yeah, exactly. You have to get up.
Yeah.
Now it's like, okay, well, I'm done. What am I going to fill this time with? What am I going to do? Mm-hmm. So to me, that's the biggest thing. What are we going to figure out? What are we going to do? Mm-hmm. And a lot of people, that's might be where, if they get lost, that's where it is. Well, if you don't have family in town or someone to spend time with, something to do, and you got to find an emotionally compelling reason to get up in the morning.
Right.
You got to find an emotionally compelling reason.
Yeah, because then I can see how not having that purpose would, you could start getting depressed.
Yeah.
As not having something to do or social interaction to work with. So what's maybe an early sign that, our retirees can maybe be aware of if they're, maybe they should start seeking help?
So early sign, especially for people when you're starting to if you are getting depressed or something like that, would be like you're staying in bed, you're not feeling motivated to do anything. Like, things you used to enjoy doing, something you used to have fun doing, like whatever that could be, whether it's sewing, kayaking, exercising. If you're not feeling like doing stuff, that's an early sign you can look at.
Right. Like maybe they used to be, go play golf on the weekends. Yeah. Now they have all the time to play golf, but now they just, don't even have the desire.
Yeah, they stay in bed, and then you're sleeping all day.
Yeah, exactly. Yeah. So, I think maybe also anxiety. Do you think that could be linked to some, anxiety about what to do, or like reinventing themselves in a way, right?
Mm-hmm. Yeah. So I've had patients where they're feeling anxious, like, okay, what do I do? What do I do is fill my time with? I don't have anything to do. What am I going to do for my next chapter in my life? Mm-hmm. And I talk to them about that. It's kind of normal to kind of feel like that. I'm not sure what to expect. I'm not sure what purpose I'm going to have in life. And you feel a little bit uncertainty about that.
Right. Do you have any maybe testimonials or patients that you've worked with, without naming names, of course, but just experiencing, maybe what has helped them in their time during retirement, or maybe they were being proactive and they're like, you know what, I've had some history of depression or anxiety in the past. Maybe now I should, be a little proactive and, start seeing my mental health provider and, seek some help prior to it.
Yeah, so a lot of times it's usually people they're struggling. That's when they come in. Usually, if they're doing fine, they usually aren't like too reactive about that.
Yeah.
But it's a good thing.
That's what we're here to do today. So you don't have to go in.
Yeah, exactly.
Getting you help right now.
So I can think of a patient. She's in her 60s. She came in. She had kind of been laid off around the lockdown time period.
Oh, that's even worse. She wasn't even expecting to retire, and I think that's especially nowadays. And then COVID, you never know. Like not even expecting to retire, and then they were forced into retirement.
Yeah.
Sorry. Go ahead.
Yeah, exactly. No, yeah, she was forced into retirement, and so now she's struggling. She had purpose. Now she's struggling. She came to me. She's having symptoms of depression and anxiety, and the biggest thing is she's going home and she's not doing anything. She's not being interactive with people. So we talked about it. Talked about different things she could do. Talked about different activities. Talking about doing group activities.
Right.
It's all about getting more involved and being around people, being social. That's usually the biggest issue I'd
Right. Do you have any, what about somebody that might have a little anxiety about even just being social? Maybe they have, social anxiety, and then, to stay healthy, they're supposed to be social. I mean, do you think maybe online support groups might help with that?
Yeah, online support groups are good with that as well. Like if you need to start, I always recommend patients, especially if they have like social anxiety, like, we all feel uncomfortable doing something, but you have to take that step. You have to take that step. And then once you do it, you realize, okay, well, that wasn't that bad. I went and I talked to these people, tried this group. It wasn't that bad. Right.
It's about growing. It's like a stair step. Growing, okay, well, I was able to accomplish that. Now I know I can accomplish this next thing. And I think a challenge helps in our mental health because it gives us that, sense of accomplishment.
Yeah.
If it's a little bit of a struggle and then we're able to overcome that. I appreciate you being able to come on here, and I will have you back. We'll be back right after this. This is Health and Retirement, and we're talking about mental health with Dr. Anthony Shaw. Hi, I'm Rebecca Jones with Health and Retirement, and we are here with Dr. Anthony Shaw still. And I think right now I would like to talk about, as we're aging, a big thing is that our mental health, maybe we lose our memory, we're starting to lose focus a little bit. Can we talk a little bit about the mental aspect as we age?
Yeah. So one of the number one things I'd recommend is you want to turn off the TV. So the reason I say
turn off the TV?
Turn off the TV.
What about the phone?
The phone. You get a little bit more engagement with the phone, but maybe that. The reason I say that is because you can watch it. I love watching my shows too, but you don't want to spend your whole time throughout the day just watching TV.
What if it's Jeopardy?
Ooh, if you're answering the questions, all right, I'll give you that. It's a little bit more active, but you want to keep your mind engaged. You want to keep doing something. Even if you're playing a video game, that's better. You want to keep your mind engaged in doing something and keep using that. You think of your mind, you won't think of it like a muscle. And like anything else, if you don't work it out, it's gonna deteriorate. So you get into exercise, you can do crossword puzzles, doing whatever you like to do, as long as it's pretty stimulating.
And that wards against maybe Alzheimer's or dementia. Do you think keeping your mind active, reading or doing those things would help against those?
Yeah, so reading is very important. Everything, learning different skills and everything, and it's helpful. And the way you want to think about it is is boosting up your cognitive reserve. So you want to think about it. It's like you're given an extra layer of defense. So even though if you might take those hits, because there's nothing that will absolutely prevent if you had dementia, but boosting that up. So when you're taking a hit, well, you might be falling, but you're from a higher place and you're not falling quite as far and quite as fast. And so you're continually training your mind. If you're not using it, then you'll deteriorate a little bit faster.
Don't use it, you lose it.
Exactly.
I had a question. I'm always very interested in maybe the different dynamics between women and men. Have you seen maybe a difference in mental health when it comes to women and men? Are women more apt to seek help, or do you find more of a decline in one or the other?
I would say women are more likely to seek help. More of my clients.
Okay, men, you heard it here.
Yeah. And the other thing is women tend to be more social in general. So that's very helpful, especially say you take a married couple and for whatever reason, unfortunately, the spouse dies. It tends to be a little bit easier for the woman because she's tend to have been more social. She tended to have been sending like those Christmas cards of family, keeping up with groups.
Yeah, staying more engaged, definitely, talking with the ladies at the salon and all that, So you bring up a great topic that I wanted to address as well. Do you find maybe relational, as people enter retirement, maybe there's more, maybe they might seek help in different relational areas?
Yeah. So in certain like relational areas, like when people are seeking help, well, sometimes it's a little bit easier if you have stronger relationships and you have people surrounding you. Well, if I'm by myself and I'm having trouble, but I'm not aware I'm having issues. Well, I'm not aware I'm having issues, so I'm not going to go in for help. But if I have either a family member or my spouse there, well, then they'll notice it. They'll notice some issues and say, hey, well, something's not acting right with my husband or something's not acting right with my wife. They're taking the doctor, even if the partner's reluctant.
Right. So it's a little bit more easier for someone else to maybe see some early warning signs of, maybe being able to seek help. What about I don't know if you do this kind of therapy or not, but do you I guess it'd be more counseling than, say a couple enters retirement, they're not used to spending as much time together. And then all of a sudden they're spending all this time together. And it's they have to kind of get to know each other.
Yeah, exactly. I don't do much counseling on that front, but what I can tell you from what I've noticed, which is from what I learned from kind of experience seeing people, is just it is an adjustment period because before you have the separation, okay, I'm going to work or you're doing whatever.
Maybe absence makes the heart grow fonder.
Exactly. And now it's now we're trying to work and figure this out together. We're spending more time together. And so if you hadn't figured out some conflict resolution, well, now is definitely a good time to work on that.
Right. Okay. So definitely as you're entering retirement, it's good to set a plan just as you do financially. You make your investments, you're getting ready for retirement financially. We're here at Health and Retirement trying to help you understand everything that has to do with your health as you're entering retirement. Your health is your greatest asset. Without your health, you can have the best investments with your money, but without your health, it doesn't do any good. So that's what we want to be proactive about. So setting, as you said, maybe making a plan as, okay, well, when I retire, set up maybe music lessons. You want to learn an instrument or get involved in groups that you can stay social, right? And be aware of any decline in motivation to do things and push past anxiety a little bit socially. I've learned a few things today, and we really, really appreciate you coming on to our show and giving our listeners some invaluable information. Again, this is Dr. Anthony Shaw.
Yeah, thank you, Rick, for having me on, and it was good chatting with you.
We will be back right after this with Market Medicare Advisors. And I'm Rebecca Jones with Health and Retirement.
Now, our health tip of the week.
Hi, I'm Rebecca Jones, and this is your health tip of the week. Did you know that magnesium is one of the most important minerals in the body? Most Americans are actually magnesium deficient. If you're having muscle cramps or muscle spasms, if you're feeling even tired, depressed, these are all signs of a magnesium deficiency. One way to make sure you are up on your magnesium is you can take a supplement. Or in addition to supplements, find a food that you like that is high in magnesium, like cashews. And this is your health tip of the week.
For more health tips, go to healthandretirement.com. This has been your health tip of the week.
Hi, and welcome back to Health and Retirement. We are joined here today with Cory Hiebert with Market Medicare Advisors. Welcome back, Cory.
Thanks, Rebecca. Good to be back.
So we just got done talking to a mental health provider, Dr. Sean, and he informed us of a lot of really important things that we need to be aware of as we're entering retirement and as mental health goes. So one question I have for you today is, how can someone, realizing that maybe they might need some mental health help, go about that if they're on Medicare?
Yeah, that's a great question, and it's really funny because whenever we talk about Medicare or medical insurance in general, we always think about our body, like what's going to cover us if I break my arm.
Right.
But mental health is just as important in the Medicare field, and we do still get coverage through Medicare for mental health.
Oh, really?
Yeah, and mental health is a really broad and generic term, and there's I did go ahead and bring with me a couple examples of things that Medicare would cover. They cover a lot of different things, such as if we're struggling with substance abuse, which is definitely a possibility. They have secession classes and counselings that we go to that Medicare will cover for us, as well as visiting with a therapist. They do group or individual therapies. But of course, I always do tell people before we jump into the mental health field, because it is such a broad field, it's important that we kind of get a direction and know where we're going. So that conversation always does start with a primary care provider.
Yes, exactly. And I think what is important to tell our listeners is you kind of want to be a little bit proactive, just as you are, like you said, in your physical health, but also in your mental health. We talked about keeping the mind going, keeping it active, and I think it's important to say maybe before you're entering retirement, if you've noticed that maybe you have had some history with anxiety or depression or things like that, maybe they should go ahead and come in and see you and see if it is on their plan. Do they have to have a certain plan? How are they going to know if that's actually covered for them?
Yeah, so Medicare A and B, we actually do see the benefits, the mental health benefits covered under Medicare Part B. Now, the extras that we would add on to Medicare, whether it be a Medicare supplement or a Medicare Advantage plan, those cover mental health issues in different ways. There is coverage no matter which way we decide to go, but it is important that you know how you are receiving your coverage. And that's something that I walk people through, that if they ever do feel the need to go visit someone like that, they know what resources they would need to go visit.
Okay, so let's go through a scenario, and maybe they do start going to see a mental health provider and they are put on some medication. How does that maybe interact with their Medicare?
Yeah, so whenever we talk about prescription drug plans, the number one, the big thing that people think about is, what if I got high blood pressure? Like, do I need to take a torvastatin or something like that
Right.
to regulate that? But Anti-anxiety or antidepressant medications, those are still a prescription medication, and we still do see coverage for those in a prescription drug plan. So that's why whenever I am setting up a meeting with an individual, to make sure that we get the most out of that one-on-one, I do recommend that they bring in their prescription list, and that would include something like an antidepressant or anti-anxiety medication.
So should they come see you if they, are about to go, they want to go see a mental health provider? And I know there's only certain times that they can make changes to their program. Is that the case? Certain times, not certain times?
Right. So if we're wanting to make changes to our plan, or say that we have been visiting with somebody and we're starting a new medication, a new anti-anxiety, a new antidepressant, anything along those lines, a mental health medication, that might throw off the current plan, prescription drug plan that we're signed up with. And they might not have very good coverage over it. It may be something that you really want to try. In that case, there's not really much we could do in the middle of the year. But just like if we had any changes in our regular medications, we would want to come in during the open enrollment period, which lasts from October 15th through December 7th. And come in with that updated list so that we're making sure that we are in the right spot for you.
Right. So it might be beneficial if you think you might need to be making changes, or you want to make sure you have a better look at your plan, to start planning maybe in September to come in, make an appointment with you. How can they get a hold of you?
Yeah, you can reach us here at 316-867-4MED. Or going to Market Advisory Group and following the booking link. You can book completely online.
Awesome. Thank you again for having time for us today to talk to you and get all that information. And again, thank you for joining us on Health in Retirement, where we want to bring you everything informed on retirement. And this is Rebecca Jones. See you next week.
This broadcast is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers and not necessarily those of Foundations and its affiliates. The information contained herein does not constitute an offer to sell any securities or represent an express or implied opinion or endorsement of any specific investment opportunity, offering, or issuer. Any discussion of performance or returns is not indicative of future results. Each individual investor situation is different, and any ideas provided may not be appropriate for your particular circumstances. Foundations only transacts business in the states where it is registered or is excluded or exempt from registration requirements. Registration as an investment advisor is not an endorsement of the firm by security regulators and does not mean the advisor has achieved a specific level of skill or ability. Legal services are offered by Eidelman Law Firm. Tax services offered by Market Tax Services. Market Advisory Group does not provide legal or tax advice. Investment advisory services are offered through Foundations Investment Advisors, LLC, an SEC-registered investment advisor.